Hey everybody, welcome back to the Outcomes Rocket. I'm so excited to be hosting Dr. Simon Thomson on today's episode in this series with Mainstay Medical around treating the cause, not the symptoms. Restorative neurostimulation is a marathon, not a sprint. We're going to be covering the topic around long-term favorable outcomes, regardless of age, with Dr. Thomson. A quick intro on him. He is a fellow of the Royal College of Anesthesia and Pain Medicine. He's the past president of the International Neuromodulation Society and has been active with the society for over 2 decades. He has a keen interest in neurostimulation, neuromodulation, and all the therapies that help patients with chronic low back pain. So glad that you're here with us. Dr. Thomson, thanks for joining.
Great. Thanks very much indeed, Saul. And hello to everybody.
Thank you. And so we're really excited to hear about the results on the study that you and your team did. Would you like to share a little bit more about it with us?
Yeah, well, I think restorative neurostimulation of multifidus is actually a unique treatment that is probably a game changer for the management of back pain. And I've been involved treating patients for nearly 7 years with this in the UK. And I've been involved in a number of studies, including post-marketing clinical follow-up study. What we wanted to do was to see whether age is a variable as to whether the quality of the outcome. And so what we were able to do was to draw on 3 major studies, such as the Reactivate-B study, which was a sham but long-term follow-up study over 5 years, the PMCF study, which is a 5-year follow-up study, and the Reactivate-C study, which is another long-term study. And what we did is we looked at the outcomes and we divided the age of each participant so they fitted into 4 different quartiles, each about a decade long. And we wanted to compare the outcomes of each quartile with each other, and also over a 2-year period. And what we were able to show is that the outcomes were the same no matter what the age. And so that we were able to conclude that age in itself is not a determinator of clinical outcome. Now that's important because as you get older, you accrue more physical abnormalities, but that in itself is not the determinator. And so it opens up and should give confidence to people selecting patients that no matter what age, they'll get the same outcome as a younger group.
That's really promising. And so we have seen, not only the long-term studies, which we covered in a previous podcast, the 5-year results. But now we're also seeing through your work, Dr. Thomson, that irregardless of age, the therapy works.
Yeah, that's right. As far as other features, I'm sure you've probably been through already, but we're really being able to sort of hone down and seeing that there's quite a broad breadth of patients who will benefit from this therapy.
Absolutely. And so, for the sake of the audience who, this might be a little bit newer to, it'd be interesting to help share and maybe take a slight deep dive into some of the benefits that people are gaining by understanding this neurostimulation. How is it a difference maker?
So obviously we are always, a lot of the patients by the time they get to us to consider this have been having multiple episodes of back pain. They might get over a long episode, they get back to work, and then within a few weeks they put their back out. Or they might just simply have chronic daily pain with exacerbations throughout the day as well. And often patients have been suffering with back pain for 10, 15 years. So they've often had a lot of health care, but not surgery, thank goodness. But they've often had a lot of physical therapy and exercise therapy and injection therapy, for example. And they're pretty disabled. And, we measure their disability using what's known as the Oswestry Disability Rating. And they were in the severe range. And similarly, you look at their quality of life, and we use something called the EQ5D, 5L, and they are depressed, if you like. That figure is very low, and we're able to lift that quality of life, improve their disability, and reduce their pain. And we're seeing patients return to a normal level of activity, and restoring patients to a level that is commensurate with normality, despite having had a 10 to 15 year history of debilitating low back pain.
Yeah, that's certainly impressive. And for everybody listening to the podcast today, we had Roseanne's story. She was dealing with major chronic back pain that was really affecting her life, and just an incredible story from her using Reactivate for the last 6 years. And Dr. Thomson, using it for 7+ years is a testament to how this therapy could work for patients. And how about the results, Dr. Thomson? Like, was it surprising to see, irregardless of age, that it was sort of like it didn't matter, anybody could benefit from it? What did you expect to see?
Well, I think everybody thinks that the outcome is going to somehow be dependent upon the sort of the pathology you see, the amount of degenerative change. But really, because this is all about the muscle control and the neural control of the core muscles that make up the mainstay, if you like, of their back. And I think we would have assumed that the younger might have fared better than the older. But that wasn't the case, because it is about, if you like, the reconditioning of the muscles.
That's fantastic. Yeah, I mean, it's encouraging to see the results that you saw. For anybody listening, let's take the physician perspective. What food for thought would you leave the physicians with? And then what food for thought would you leave patients with?
Yeah. Well, I mean, I'm not only motivated by trying to create good studies and good data, I'm always very much motivated by the reaction of patients. And that's the wonder of neuromodulation, is that we end up with a lot of very happy patients. And this is a group who were not well served, patients with back pain with a multifidus dysfunction, until this therapy came along. And I know a lot of physicians worry about there are sort of, if you like, competing treatments, but I think you have to go where the evidence is. And the evidence is that restoration of function is there for the long term. Whereas a lot of the palliative treatments that we do for back pain, such as radiofrequency ablations, although helpful, are often need to be repeated and may not and do not actually restore the function. But you can persist, if you like, with trying to palliate, but you eventually run out of road on that.
Yeah. Yeah. So ultimately, follow the evidence, right? So physicians listening to this, there's the evidence that's available. We'll link it up in the show notes, as well as from episode 1 that we did with Dr. Gilligan from the 5-year results. So let's follow the evidence. I love that call to action from you, Dr. Thomson. And what about for patients listening?
Well, I think for patients, what's important with this therapy is to get the expectations right. It's not an on-off switch. This is a slow burner, a slow trajectory upwards. And we often explain to patients that, some will start to see benefits after 3 months. Others, it will be after 6 months. But you're not even at maximum benefit, probably for a year or more for many. So it really, we've got to reverse change something that's taken years to evolve over time. So patience is important. And as far as the sort of there are patients worry about the invasiveness of it. And I can tell you that for many of my patients, they'll tell me in the hospital ward afterwards that this was way better than they had expected, and that frankly it's easier for them to tolerate than some of the injection procedures that we and radiofrequency procedures that we do.
Wow.
As far as having an implant, I mean, that will get smaller, but I've not had anybody complain, if you like, about the size of the implant. Also, it's not in the spine. So unlike spinal cord stimulation, where there is always a danger of damaging the dura or the cord, this is outside of the spine, and is that much safer as well. And the other thing is that compared to some of the other traditional therapies, such as, for example, back fusion, which has got a checkered outcomes anyway, you could, if you had to, take it out. And sometimes we do take them out, not because necessarily always treatment failure, but because after 5 years, a patient feels that they can manage themselves. Thank you very much.
That's fantastic. That is fantastic. Yeah. So the safety features are there. I'm impressed with how quickly people will start getting benefits. I had a chance to talk to a couple patients through this series, and like 3 months, 2 months sometimes to start feeling it.
Yep. So I have a theory I yet to prove that depending upon the initiating underlying cause of their pain, that there is a slightly different early trajectory for improvement. I've got a pretty clear idea about that, and it's been pretty accurate so far. But I think the main thing is just to warn patients that it will take time. And I tell you,
that's fair.
Patients are often, when you explain it to them and you get them to look at their MRI scans, see where the fatty infiltration is, they like, this is not a free journey, this. They have to have the discipline to activate morning and evening every day.
That's a good call.
And a lot of them do that. And they really feel like they're doing something for themselves as well. Cynics may say it sounds all very passive, just lying there and letting your muscle be stimulated. But the reality is that there is a big discipline that they undergo to make the benefits happen. And they remain often very motivated to do it. The compliance is good, even out at 5 years.
That's great. Well, in chatting with some of the patients that have received the therapy, if they don't, they start feeling it again, and the motivator is there to make sure that they're using the therapy. So certainly not automatic. Got to do it yourself. The benefits do come. And this is fantastic, and it's not tied to your age, as we've heard today with Dr. Thomson. So really appreciate you coming on the podcast, Dr. Thomson, to share your research and your clinical experience. Any closing thoughts that you'd like to leave us with?
Well, I think the main thing is that we've got to make sure that patients have access to this therapy, whatever your healthcare system is. And it's introducing something new into a relatively conservative, if you like, profession, who have got their own particular biases towards one therapy or another, is quite difficult to achieve. And so podcasts like yours, Saul, and the evidence base that Mainstay Medical and with their partners like me are building is the thing that will eventually convince everybody. I think it's really important because we've got to keep this therapy. Agreed.
No, I great call there, Dr. Thomson, and for everybody listening, take a look at what's out there. The evidence is there, and today's episode is really focused around these age ranges. It doesn't matter, and great therapies that have data stick around, and we're very hopeful that the same will happen with this therapy. So, Dr. Thomson, thank you for your hard work and thoughtful approach in this. We really appreciate you being on the podcast.
Great. Thanks very much indeed, Sil.